Okay. Good evening, everyone. This is Dr. Akuna Gabriel, your lecturer for gross anatomy. This lecture is paramount for those, for everyone, especially for those who missed the last lecture because they couldn't be online. Out of a class of 240 something, we only had about 80 something participant in the last class. So this is the reason why I'm going to be doing a recap uh, of the last lecture that we had. And in the last lecture, we spoke about the pelvis, the pelvic bone. So I'm going to be picking this bone and to letting us know that the pelvis is the pelvis. We have a pair of it, and the one on the left hand side and one on the right hand side. Okay, that form the pelvis. Okay, so we have the pelvic bones that form the pelvis. Okay. Now, I remember when I was talking to you about the upper limb. I told you that the upper limb is similar to the lower limb. So there's a bone in the upper limb that is very similar to that of the lower limb here, respective as far as the pelvis is concerned, and that is the pelvic bone, okay, which is similar to the scapula. Okay, so we are going to be so since we are going to be talking about the pelvic bone, we won't be talking about these two. So we have one here, and we have this other one here, but we are only going to be talking about one. So we're going to be talking about only one of this. Okay, so having said that, um, uh, we are let's pick another image to expatiate the lecture. Now, look at this bone here. This is the pelvic bone, and here we have the east. We have three of them, three of the pelvic bone. Okay, so but they are all together. No, now let's use this analogy. The pelvic bone, they are like three sisters, very beautiful sisters, and they are joined together at the midline by what we call the triradiate ligament. The triradiate ligament, by the triradiate ligament. Okay, join the three sisters in the midline. But before I talk about the triradiate ligament, it's better to talk about, okay, since the three sisters are very beautiful and just like every other bone, they're going to be having external forces. They're going to be looking for their hand in marriage. Okay, so they need to bond together to remain as one. So they bring their hands together, and in bringing their hands together, they form what we call they form a ring. We are going to call that the acetabulum. So they form a ring. We are going to call the acetabulum. So they form a ring. We are going to call the acetabulum. Now, this acetabulum is formed as a result of the bonding together of the three different parts of the pelvic bone. Okay. Now, since there are three different bones coming together as one, and they at the midline where they form the acetabulum. Mind you, the acetabulum is the point where the head of the femur is going to be articulating with, just like the glenoid fossa in the upper limb. So now let's pick another image to expatiate the lecture. Okay, now let's pick this image here. Now, if you look at this image, there are three sisters, quite all right. One, two, and three of them. Now, but of course, one of them is the most senior. And since the ilium, since this bone, number one bone, is located superiorly and it looks to be bigger, then we call it the elder sister. So That means we are going to be isolating this particular bone here, this particular area. Okay. Now let's pick part of the this bone. Let's pick part of this bone here, and let's call it let's go to the anterior part. Now it has angles. If you look at this bone from left to right, it has angles. It has shapes. It has different shapes. It has different shapes. Now, of course, in anatomy, everything has a name. Okay, so we are going to be giving this shape names. Okay, let's start anterior. Let's start anteriorly. Now, imagine if this bone is yours. This bone has to be the right bone, sorry. So the right bone, it means that this is the right bone because the this is number one bone and this is number two, this is number three. It means that number three bone is supposed to be located in front, while number two bone is located at the back, and number one bone is located superiorly. So by isolating this, let's look at the anterior part of this bone. Now, if you look at the anterior part of this bone, okay, if you look at the anterior part of this bone, um, um, you come across the first angle. Let's talk about this angle. This angle, this part of this bone is called the anterior inferior iliac spine. The anterior inferior iliac spine, the anterior inferior iliac spine, the anterior inferior iliac spine. Why this part of the bone is called the anterior superior iliac spine? Of course, it's superior to this inferior part. So we have an anterior superior iliac spine and we have an anterior inferior iliac spine. Every part of this bone has their function. Okay, what is the function of the anterior inferior iliac spine? The anterior inferior iliac spine serves for the attachment. It serves for the attachment of the biceps femoris muscle and what we call the Y ligament of Bigelow. It serves for the attachment of the biceps femoris, sorry, my handwriting is very bad, of biceps femoris, and what we call the Y ligament of Bigelow. Let me clean this up so that I'll write it better. The ligament, the Y ligament, of course, ligament of Bigelow. Bigelow will be Bigelow, the Y ligament of Bigelow. Okay, as we progress towards the other phase of the lectures, we're going to be coming across what the Y ligament of Bigelow means. So I've told you the function of the anterior inferior iliac spine. Now let's talk about the function of the anterior superior iliac spine. Of course, for those of you that attended the lectures the last time, remember I said that the anterior superior iliac spine serves for the attachment of the longest muscle in the body and probably the thinnest muscle in the body. It's called the sartorius muscle. The sartorius muscle is called the sartorius. Sartorius. This should be R. Sartorius. Sartor. Sartorius muscle. Sartorius. Sartorius muscle. Another name for sartorius muscle, you guys will see I've come again. Another name for sartorius muscle is called the talar muscle. The talar muscle gets from the name from the fact that it looks like it taper, so it's called the talar muscle. Okay, now let's move on. Now let's clean this off. Now if you look at this part of the bone, it has, okay, let's talk about the posterior part of it. If you look at the posterior part of it, now look at the posterior part of the there's something I didn't introduce the ilium. Introduction of the ilium It's simple. All you have to say that the ilium forms the superior part of the pelvic bone, or it's an or also the superior part of the acetabulum. The superior part of the acetabulum. Don't forget that this is the acetabulum here, so it forms the superior part of the acetabulum. Okay. So now let's look at this. The posterior superior iliac spine. Okay, we have gone posteriorly now. So the posterior superior iliac spine, and we also have the posterior inferior iliac spine. So this is going to be an assignment. Since I've given you what attaches to the anterior superior iliac spine and anterior inferior iliac spine, I want you to find out what are the structures that are attached to the posterior superior iliac spine and posterior inferior iliac spine. Okay, that's an assignment. Now, look at this. There are two other spaces down here. If you look at this space and you look at this space, the space here is called the superior sciatic notch. The superior sciatic notch. The superior sciatic notch. So that should be the superior sciatic notch. Okay, now this one is called the inferior sciatic notch. Okay, so the superior sciatic notch and the inferior sciatic notch. So it is safe to say that the posterior inferior iliac spine forms the superior margin of the uh, greater sciatic notch. Why the ischial spine? So let's not talk about the ischial spine right now, because the ischial spine uh, is actually uh, um, the ischial spine is actually uh, 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 okay. Sorry for the distraction. The ischial spine is actually part of another bone, so let's not talk about it. Okay, so um, okay, so uh, let's take this off. Okay, so we've you see this greater sciatic notch and the lesser sciatic notch. A time will come, they are going to be called the greater and the lesser sciatic foramen. So in life, it's not called the notch, it's called the greater sciatic foramen. And in the course of our lectures in the lower limb, we'll be coming across structures that enter and leave this foramen. Okay, so let's look at uh, uh, other parts of this bone. So we've looked at these contours. Now let's look at, if you notice here, you see that this part, the superior part of the ilium is rough in nature. The superior part of the ilium is rough in nature. That's the superior part of it is rough in nature. Now this superior part of it actually is called the iliac crest. Iliac crest, okay, the superior part of this bone is called the iliac crest, and it extends from the anterior superior iliac spine down to the anterior posterior superior iliac spine. So the iliac crest extends from the anterior superior iliac spine down to the posterior superior iliac spine. So let's look at some of the features of this iliac crest. This iliac crest, of course, if you look at this, it has if you look at this, it has different parts. Now see, I want you to look. Let's make use of this labeling. Look at this, please. You notice that there's an external lip of the iliac crest. So the iliac crest has an external lip, and it also has an intermediate line, an intermediate line, an intermediate line. Okay, an external lip and an intermediate line. Now look at, there's something else interesting about the iliac crest. It has something that looks like a tubercle, or a tubercle. It has a tubercle. This tubercle is called the tubercle of the iliac crest. It's called the tubercle of the iliac crest. So let's draw a line. Let's draw a line here and call it the tubercle of the iliac crest. Now look at this. The iliac crest is located 5 to 6 centimeter posteriorly from is located 5 to 6 centimeter posteriorly to the anterior superior iliac spine. So I can say that um, the tubercle is located 5 to 6 centimeter, 5 to 6 centimeter, okay, posteriorly to the anterior superior iliac spine. This information is actually paramount. In fact, all the information here is paramount. So we have done justice to the iliac crest. Now let's move down to if you notice again on this ilium, of course there are three lines. There are three lines here. If you see, there are three lines here. We have one line here, we have another line here, and we have another line here. Now, this is the lateral view of the pelvis we are looking at. This is the lateral view of the pelvis, which means that if someone is standing by your side, this is what the person is supposed to be seeing if the person, of course, were a skeleton. Okay, so this is the lateral aspect. So it has three lines. Okay, so let's use different color for this line. So let's call this the red line. Okay, and let's call this uh, the blue line, and then let's call this uh, the pink. Is that pink? Yeah, that the pink line. Okay, now the red line here is going to be called. Sorry, the red line here is going to be called. Uh, is going to be called the posterior gluteal line. These are gluteal line. Gluteal means the back, the buttock. Okay, so this part of this bone forms the gluteal region. Okay, of course the gluteal region around here, all this forms the gluteal region. Okay, so sorry. Okay, so we are going to be saying that. Let me continue making use of this red line. So this red line is called the posterior gluteal line. Now, this blue line is going to be called the anterior gluteal line, while this one is going to be called the inferior gluteal line. These gluteal lines are responsible for providing attachment for three important gluteal muscles: the gluteus maximus, the gluteus medius, and the gluteus minimus. Not in the same order. Okay, so another assignment, you need to find out which muscle is attached to which of this line. The gluteus maximus, where is it attached to? The gluteus medius, where is it attached to? The gluteus minimus, where is it attached to? So we've done justice to this part of the ilium. Now let's take a look at the medial view of, or let's look at the medial view of the ilium. Okay, so that we know that the medial view. Okay, let's just say what we are going to come across in the medial view, or okay, let's look at okay, let's still look at this medial view. Okay, so the medial view, this area of the medial view, okay, this area, if you look at, this is the lateral view actually, but if you look at it from the medial aspect, that this area is going to be given attachment for a muscle called the iliacus. Iliacus. It's going to be called the iliacus. Okay, so so that we won't waste our time by going to look at the images of the media aspect. Okay, so now the other sister, if you look at this bone very well, which one would you say is the second sister? Of course, we're going to be picking this bone. This is the second sister here. All right, so this bone is called the ischium. This bone is called the ischium. Remember that the ischium, when you remember the ischium, think of, these are three sisters, and two of them, they are actually jealous of the elder sister. That's the ilium. They are jealous. So number two and number three, they are jealous of number one. Of course, number one is the biggest and he has a lot of attention. Okay, then number two, of course, is the second most beautiful. So we are going to be calling that the ischium. The ischium. So think of the bone that you're sitting on right now. We can say you're making use of your ischium to sit. Okay, not entirely true because of course the ilium also serves for this function, especially when you have the gluteal muscles that are attached to a major part of this bone. So let's just literally say that you're sitting on your ischium right now. Why? Because the ischium forms the inferior, the posterior inferior aspect of the acetabulum. So you can see the posterior is located posteriorly and is located inferiorly. So posterior inferior aspect. So that's the introduction to the ischium, the posterior inferior aspect of the acetabulum. Okay. Now, what are the most interesting part of the features of the ischium? The ischium has now, since they are jealous of these sisters, they end up having a meeting at the back. Even though they are supposed to be meeting only here, they still go behind, the ilium to meet around here. Okay, so it means that they have two hands. They have one hand here and they have two hands here. One hand to form this ring and another hand to form another ring. So these two sisters are meeting behind the ilium. Okay, so because they have two hands, we are going to be calling this hand the inferior ramus. So this hand is called the inferior ramus of the ischium. So the inferior ramus of the ischium is going to be forming a joint with the inferior ramus of the pubis. So at the end of the day, we are going to be calling this the ischiopubic junction, or what we call the ischiopubic ramus. Ischiopubic ramus here. Okay, so we are going to be, so we have the inferior ramus. Now, if you notice, a particular area of the ischium is rough. This area is going to be called the um, the the ischial tuberosity. You can see the labeling here. It's even here. The ischial tuberosity. The ischial tuberosity. Remember the bone or the process that I nicknamed the promiscuous process. That's the coracoid process in the upper limb. So we are going to be calling this the promiscuous tuberosity. The promiscuous tuberosity. Of course, as the lecture go on, you're going to know why I give it this nickname. So we have mentioned two things now. We have mentioned the inferior ramus of the ischium, and we have mentioned the ischial tuberosity. A lot of things are going to be attaching here. A lot of magic is going to be happening here. Okay, it's going to be happening here at the ischial tuberosity. Another part that the ischium has is the body. It has a body. It has a body. So this body is called the body of the ischium. Okay, so it forms a body that helps. So we might not really call that the superior ramus. So we call that I'm just using the superior and inferior hand as a means to explain better to you. So that's that. Now the ischium has another thing that is very important. It has the ischial spine. It has an ischial spine. Remember when I was talking about the lesser sciatic notch? The lesser sciatic notch is located on the ischium, while the greater sciatic notch is located between the ilium and the ischial spine. So we can say that the ischial spine, okay, we can say that the ischial spine located at the ischium forms the lower border. It forms the lower border of the greater sciatic notch. It forms the lower border. So we can say that this ischial spine forms the lower border of the greater sciatic notch. Okay, now we can also say that the ischial spine forms the upper margin of the lesser sciatic notch. So we have dealt with this now. Now let's go to the ischium. Of course, the ischium need no introduction, as it need no introduction. It need no introduction, as we are going to be talking about different part of the ischium. Of course, I need not introduce this again. This is the inferior ramus of the pubis. Sorry, I've talked about the ischium. This is the pubis right now. So we are talking about the pubis right now, and the pubis does not need any introduction. Of course, by now you should know that it is the youngest sister, and no offense, uh, probably the ugliest. But just because it's the youngest sister and the ugliest doesn't really mean it doesn't have stuff. In fact, we can say without this bone, every other part of the ischium might not every other part of the pubis might not really be doing their job properly. So we are going to be calling this the so it has an inferior ramus here. It has an inferior ramus here. Then it will also have a pubic tubercle here. The pubic tubercle is right here. It's growing from this aspect. Then of course it's going to have an obturator crest. All these have their function, an obturator crest. And of course, remember I didn't say this, but it's important because the ischium and the ilium is meeting inferiorly behind because the ischium and the pubis is meeting inferiorly behind the uh, the ilium. It's paramount. It is paramount to tell you that they will form what we call the obturator foramen. So they have formed what we call the obturator foramen. This obturator foramen will be covered in life by the obturator membrane, except for a small space called the obturator canal for the obturator artery. Okay, so uh, let's look at this. So we have the inferior ramus of the pubis. We have the pubic tubercle. I want you to take note of the pubic tubercle. It's very important. Then we have, of course, the superior ramus. Okay, we have the superior ramus. So we have talked about the inferior ramus. We'll talk about the pubic tubercle and the obturator crest. Except that I've not told you the function of the obturator crest, but I've also told you about the obturator foramen. Now let's go down to let's pick this bone. Let's go to the medial aspect of this bone. So we are going to be picking this one here. So if you look at this bone here, you see that the ilium has other things that we didn't speak about. So here in the ilium, you see something that looks like an ear. Yeah, you see something that looks like an ear. This uh, ear-like structure is called the auricular surface of the ilium. The auricular surface of the ilium serves for the attachment to the sacral bone. Okay, attachment to the sacral bone. Of course, if you look at located superiorly to the auricular surface, is the iliac tuberosity. Iliac tuberosity is also very important. The iliac tuberosity. So we have spoken about the this one and this one. Then there's something also that I mentioned the other time, and I didn't want to waste your time with it. I told you that this place is called the iliac fossa. This part of the ilium is called the iliac fossa, and it gives attachment to the iliacus muscle. Okay, that's also an important knowledge. Now look at the. I want you to look at the medial aspect of the pubis. Look at the medial aspect of the pubis. You will notice something different. You will notice that there is a flat part of it that we are going to be calling the symphysial surface. Remember when I introduced this lecture, I told you that uh, 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 this pubic bone we have two of them, left and right, so they join together at the midline. So at the midline, this is where they are going to be joining. So each of these pubic bone has a symphysial surface. So this symphysial surface will join with another symphysial surface of another pubic bone to form the pubic symphysis, which is an important joint located anteriorly. So the pubic symphysis. There's also something I didn't mention before, but now I want you to find out about this. Here we have what we call the pubic tubercle. I've talked about it, but I didn't tell you about what I didn't tell you about is the um, what I didn't tell you about is the pecten pubis located right uh, located right here, the pecten pubis located right here. So you are going to find out what it does. Now the pubics, I also gave a different assignment. I also gave an assignment that you people should find out the differences between the pubis, the pubic bone of a female and that of a male. So you're going to be submitting to me in the next class. So in our next class, we're going to be talking about the obturator foramen proper, and we're going to be talking about that ring that was formed by these three sisters. That is the acetabulum. So I think we have come to the end of course, apart from the applied anatomy here, it's that there can be fracture of this bone. Okay, and the fracture of this bone, and of course this bone forms three different joints. It has a joint between the auricular surface and the ischium. Of course, it forms a pubic symphysis that's with each other. Then it forms a joint with the head of the femur, that's the biggest boy in the body, forming a joint there called the hip joint. Okay, so those are the three joint. Of course, they can be fracture of this bone. So in our next class, we're going to continue in our next class. Um, like I said, I want you to leave a feedback. I want you to leave a feedback for me on WhatsApp. So my number is 080 38 61 95 26 080386195. So this is supposed to be 59526. Okay, so my name is of course for those of you that don't know, my name is Gabriel. Okay, okay, okay. So thank you for listening to this lecture.